you go, Jerry. You can start.
I will start as soon as we hit 11 o'clock and we get everybody in. Gary, keep us updated on attendees and when you feel like the flow has stopped in terms of people entering.
We're going to start at 11 exactly, regardless.
Okay. Oh, and I can see the numbers going up for participants at the bottom.
Yep, I see that too. And you want our video to be up right now, Jerry?
Yes, please. That'd be great, John.
There I be.
You're not on, are you? Because it'll echo otherwise. Okay.
You told me to come down here?
Yep.
You're okay if I'm sitting here?
I'm absolutely okay with that.
Hi,
Tammy
Tammy.
and I are making sure that we conserve bandwidth here too.
Beth, are you back on?
Morning.
Good morning, Tim.
Hey, Tammy, how are you?
I'm good.
I'm here.
Okay, sounds
Actually,
good.
Can you hear me?
I get to see my husband during the workday today.
Yeah. I think Gary had a question for
Susan,
you,
can
Beth.
you hear me?
Gary? Yeah, I can hear you. Can you hear us?
I think I figured it out, Beth. I was worried about how to start the recording, but I think I have it. Just so everybody knows, we are
Yes.
now broadcasting.
Yeah, on the bottom, there's usually just a little button that says record.
It usually is, huh?
On my computer, do you think just having
No,
the
you're
computer
fine.
running is mission?
You're fine. And I just want to start off by saying this is new to us. We just upgraded our membership to be able to provide this for you in terms of our Zoom account. So because it's our first run, we may experience some technical difficulties, and certainly we're hoping not to get the Zoom bomb that we've heard occurring throughout the nation as well. But if something like that does occur, we'll just ask people to log off and then we'll follow up later with the video recording. A couple of things that we'd like to give you for a few reminders is, first of all, you should be muted as you log on so we don't have any background noise for the presenters. Pretty soon you'll see each of us turning off our videos as well. We're only going to have the video for the person who's actively presenting so that people who are observing or watching in areas where they might have limited internet access or bandwidth can still get good reception. So ask that everybody have their cameras off and be muted. Any and all questions we're going to ask you to put into the chat box, not the question and answer box. We'd like them in the chat box, please. And we'll be monitoring that and trying to answer some of those as we go at the end of each of the presentations. And then follow up if need be with an additional session. Let's see, there's some QR codes that are going to appear for the links so that you'll be able to scan those and go to those. Also a note, the presentation is being recorded and will be available being recorded as well. So just take that into consideration with your comments and with any of your questions. Then the last piece is that I want to introduce who our speakers are. So today we have with us Julia Hartwig and Susan Piazza. And you know, I've had the privilege, and we as a board have had the privilege of getting to meet with each of them virtually, and certainly created more comfort and confidence in us in our district responses. So that was the primary reason for having this available to you today. And also joining the two of them are Patty Williams and Beth Herman, also from DPI, to assist in the messaging. Representing WCASS, we have John Peterson, past president. We have Sarah Totten, president-elect, myself, and Gary Myra is here. And I better introduce my wife behind me as well, Tammy Nicholson. So we are going to be muted throughout most of the presentation, but we'll be here if questions arise or if any examples need to be shared. So with that, we'll go to the next slide, Gary. Just a reminder for everyone to be gentle with themselves and with each other. Again, this is our first time doing this. We are not looking to have this be you know, a well-rehearsed machine as much as it is a dialogue and a conversation for us to have together. So with that, I will turn it over to Julia and we will begin. Thank you, Julia.
Great. Thanks, Jerry. First, I want to just start off by extending a huge thank you on behalf of Carolyn Stanford Taylor and the department for all you have done over the last month or two. Your lives, both professionally and personally, have been turned upside down. Your efforts to get quality programming in place, to work with families, to get food into the hands of those who need it, to coach staff in an entirely different way of working with families, educating kids while you're learning that new way yourself is really commendable. I very much hope that you, your families, your staff, your students are healthy and that you're taking time to take care of yourselves. So that's kind of first and foremost. I also want to thank the WCASS leadership for their responsiveness and their full engagement in this process and for their continued partnership. So I'm going to start off by providing some general information on kind of where we're at. Patty Williams is then going to take over and go into some details related to teleservice, evaluations, IEP meetings, and placement implications, kind of through the special education lens. And then we're going to hand it off to our SSPW colleagues to focus in on other resources within the agency, as well as mental health during this time. We'll leave some time for questions at the end. You can, as Jerry mentioned, you can continually put those in the chat box. Know that there are things that we can't answer at this point that we just don't have the information for, and that information is rapidly changing, as you know. So right now, we're in this time period where we have the Safer at Home executive order, we have the school closure order, we have the public health emergency, and all of these sort of have had and have changed. There's different end dates to all of these. Carolyn Stanford Taylor last week sent a letter to all district superintendents asking them to prepare for in the event that schools are closed for the remainder of the year. That's not been a statewide order at this point, but to have that preparation in place, to be thinking about summer, to be thinking about next school year. Additionally, Mike Thompson sent a district administrator email last night, kind of starting to further explaining that, or kind of further reiterating that we're planning out at this point. We'll of course keep you updated on any information we hear, and I know also that your WCASS leadership will as well. We encourage districts to provide services to the extent possible. We certainly recognize that these are unprecedented times and that you simply cannot carry services out as planned. We are encouraging making learning accessible and to implement IEPs to the extent possible, but know that we are and we will continue to be as flexible as we have the authority to be. We're in this together, we're all figuring this out together. So I want to really relay that to you, that we are being as flexible as we can be, and we'll continue to do so. Communication with parents seems to be the key here, the success that we have heard, and I'll talk a little bit about that on another slide. So Gary, you can advance to the next slide. This is a quote taken from OSEP guidance that no one wants to have learning coming to a halt across America due to the COVID-19 outbreak. And the U.S. Department of Education does not want to stand in the way of good faith efforts to educate students online. This is coming kind of after the first wave of guidance from OSEP, the Office of Special Education Programs at the U.S. Department of Education, really focused on, or there were some questions and answers around if schools aren't providing any services to kids, period, that they're not obligated to provide services as outlined in IEPs. That was sort of when we were thinking, kind of everybody was thinking we were in this 2 to 3 week closure sort of situation. When it became apparent that the school closures were going to be beyond that, there was a need for a little bit of a shift in messaging, because they realized that what they were hearing is that across the country, there were some districts that were making the decision to not offer any programming to any students because of the fear of not providing IEP services as outlined in IEP. So they quickly issued additional guidance with a focus on good faith efforts to educate all students online. And this is what we have been telling Wisconsin districts: do the best that you can. We know that you cannot replicate a typical school day, and in no way do we want for attempts to educate kids during this time to feel risky. We're asking you to do the best that you can given the circumstances, and again, to the extent possible, make learning accessible and to implement IEPs to the extent possible. Again, I want to encourage, oops, I'm actually just getting to that slide, Gary. I want to, again, kind of emphasize this partnership with parents. In particular, the success stories that I've heard, and some of which have come from your WCASS leadership, is that those districts who have really taken collaboration with parents and families really seriously at this point have seen really great success. I'll share a story that I heard from an RSN just this week when I was on a meeting with them, and she said that she has seen true partnership with parents to a greater extent during this time than she has ever witnessed before in her career. And I think that those districts where we have heard where their reaction was to pick up the phone, the parents of students with IEPs, and to say, hey, this is a situation we didn't plan for when we wrote your child's IEP. This is a situation we've never been in before. We don't know exactly what to do. Help us can we figure this out together? What would you like to see during this time? How can we work together to make this work and to provide services to the extent that we can? I think that will go so far, both right now as well as in the future when we are thinking about what comes next. Okay, and then of course that second bullet point again, provide instruction and special education services to the greatest extent possible so students can continue to make progress in the general education curriculum. Okay, next slide. So for OSEP guidance, schools may not be able to provide all services in the same manner they are typically provided, as I mentioned before, and special education law does allow for some flexibility in determining how to meet the individual needs of students with disabilities. And Patty is going to go into some details on the flexibility that we are providing here in Wisconsin. Before I turn it over to Patty, I just wanted to hit on, and you can advance to the next slide, Gary. I just wanted to hit on some fiscal guidance that the department has released. There is a link in there. I didn't put it in there in time for Gary to turn it into a fancy QR code. So I will copy and paste that as soon as I'm done speaking and put it into the chat, that link. So the school financial services team, in collaboration with many of the programmatic teams, including the special education team, created an FAQ around fiscal matters during this time. So a few dot points that we've pulled out from that FAQ are around competitive grant applications right now. To the extent that we are allowed to, we are extending competitive grants application deadlines, and one special education grant in particular right now is the Transition Readiness Grants. That original deadline was April 1st, and that has been extended to May 1st. You can see what all of those are if you go into the DPI webpage and you put in the search competitive grants. There's a webpage that catalogs all of those. For maintenance of effort, at this point, there are no additional exceptions to LEA MOE. It would take an act of Congress to put those in, and we do know that there have been lots of letters and comments submitted to Secretary DeVos and OSEP related to MOE. If anything changes, we will get that information out as soon as we receive it, and I know WCASS will as well. For equitable services, if an LEA has suspended all instruction to public school students, then services to parentally placed private school students with service plans can also be suspended. If the LEA is providing instruction to public school students through alternate means, then the LEA should consider continuing those services for parentally placed private school students with service plans. And of course, that would be in collaboration with the private school and kind of to what extent and what that would look like and all of that. You do not have to revise service plans. Service plans don't need to be revised. And of course, because parentally placed private school students with disabilities don't have that individual entitlement to FAPE, there wouldn't be the same sorts of considerations later on for compensatory services and those sorts of things. That wouldn't apply. For your employees that might be federally funded right now, we know that during this time, this has come up, for example, in the context of paraprofessionals, kind of reassigning them to distribute food, to do other things that aren't necessarily aligned with the federal program. So IDEA in this case, for example. You can continue to pay federally funded employees, and you do not have to recode their salary and benefits out of the federal grant program. We received a lot of these questions right away, and so kudos to those really responsible business managers that called right away and said, do we have to recode? You can keep those in Fund 27. We made that decision kind of right away, and OSEP actually just released some guidance reiterating this, that they encourage an attempt to align their work with their appropriate federally funded program, of course, but know that during this time, it's such exceptional circumstances that you keep them coded. There is an emphasis to continue employment across the country. So that's a nice flexibility. The CARES Act. So the CARES Act is also called the Elementary and Secondary School Emergency Relief Fund. So these additional dollars will flow through to districts as a formula fund based on Title I allocation. So it's Mike Thompson sent some additional information on this just last night. So there's some additional details available, and Susan will point to where all of those emails are archived on our website. So while the calculation is based on Title I allocations, the allowables within the funds are broader than that, and specifically special education and mental health are mentioned within there. So those services are permissible. We don't have a lot of information at this point. We don't have specifics on how it will be administered or real specific timelines, but we're getting closer to that every day, and there's a number of things we're waiting for still from the federal government, because we still have to apply for those and receive them, and then we're working out how we'll get those out very quickly to districts. So more to come on that as that becomes available. A number of waivers were also articulated under ESSA in particular. And you might know also that Secretary DeVos has a short period of time to recommend flexibilities or waivers under IDEA. We know that there have been many letters sent and other comments sent. So keep you posted on that as well. So now I think I'm ready to pass the mic over to Patty.
Thanks, Julia. So I think we can go to the next slide. And I'm Patty Williams. I'm an assistant director, and I oversee both the monitoring and then the dispute resolution processes for the department. So I've been working on some guidance that we've developed and put out in response to the public health emergency to sort of help navigate IDEA requirements during this time. And I can tell you that IDEA was not enacted with the thought of having a global pandemic. So as Julia mentioned, we have been trying to be as flexible as we possibly can and to sort of balance what's feasible, what seems appropriate and reasonable, and in where we can provide flexibility when we can. So the first document that I wanted to highlight was our guidance on teleservices. This went out, I believe, last week, and I did provide a link to the guidance document within the PowerPoint. And I just wanted to highlight a few things. The first is that if you're using teleservices as a related service, so if you've determined that that is appropriate for a particular student to provide the related service, then you don't have to have an IEP team meeting to switch that delivery. So I wanted to point that out that, you know, if you're thinking about providing related services and you think it's appropriate for a particular student, you don't need to then have an IEP team meeting. What you should do, and I think this is the message sort of throughout our guidance, is that you want to document that you're providing it in this way, and then you want to communicate with the parent to how it will be provided. Those are sort of the two big pieces, communicating and then documenting. The guidance document also provides some general considerations to think through before delivering teleservices, such as thinking about settings for both staff and the student, identifying resources that will help staff to assist in making the transition to a teleservice delivery. So the document sort of gathers those resources and points to other things to think about. And then finally, the document covers DHS's recent policy change in allowing schools to temporarily bill Medicaid for therapy services that are delivered by teleservice. So before, they did not permit this, and they are allowing sort of a temporary change to bill for Medicaid. The document itself outlines the conditions that have to be met in order to do so. And it also makes it clear that this sort of policy exception is only limited to during this public health emergency. So it also clarifies that. So then I think we can switch to the next slide. Okay, so the next document I wanted to mention is our frequently asked question and answer documented related to COVID-19 closures. And, you know, I want to thank all of you for bringing these questions to us, and so that we are able to think through them and address them. We've been meeting with our RSN directors on a weekly, if not sometimes daily basis, and they've been helping us sort of gather the questions and then be able to respond to them. Our question and answer document is updated weekly, and so as it's revised, it gets posted on our website, so you can always look there for the most recent revision. And then also it goes out in the Thursday division newsletter that Dr. Van Haren sends out in her email every Thursday, so you can look for it there. What the guidance document, I will say, is approached, and how we've approached it is really through two lenses. The first and foremost, as Julia mentioned, is that, you know, we're thinking about the safety of students, families, and staff during this time. And so that is sort of one of the sort of major lenses that we're thinking through as we're answering these questions. And so everything we are doing and being asked to do during this time is within this context of a public health emergency. And because of that, as we sort of thought about the answers, certain activities simply aren't possible, such as testing for doing evaluations. That most likely isn't possible during this time. And then we've also looked at sort of what's feasible, right? So there's been this sudden change, and now kind of what's feasible to do during this time. One of the things we thought was not feasible was having an IEP team meeting for every student with an IEP. That just wasn't feasible. So in developing this guidance, we looked, and given this public health emergency, what's possible and feasible during this time, and then to allow for flexibility whenever we can. So that's kind of how we developed it and the framework for answering the questions. So we can go to the next slide. Okay, before we go into the slide, I did want to mention, so the revision to the document is being released again today because it's Thursday through the newsletter. And what we've done for this most recent version is that we've now broken it down into topics because it was getting quite long. And so we thought it'd be easier to find answers to questions if it was divided by topics. And then we're adding 2 new questions around SLD evaluation. So that will be included as well. Okay, so with regard to evaluation timelines, I think this reflects sort of how we're thinking about what's feasible and possible, is that we're saying that districts and IEP teams should proceed with evaluations if possible. For example, you know, if the testing's been done, or if the review existing data, you determine that no additional testing is needed, you can proceed with those evaluations. And we'd really encourage you to do so because, you know, you want to keep meeting the requirements and doing as much as you can during this time. But if, for example, you know, there's testing needed that you simply can't do, then, you know, there is an exception to not meeting the 60-day timeline. So you just want to document the reason for the extension, that, you know, that due to the public school closure, testing was not able to be completed, and then communicate with the parents the reason for that extension. We've been asked to have a form that can document that extension. We don't have a model form right now that provides for that sort of, you know, documentation. But we are going to post in the next few days a district model that both provides for that communication to parents, as well as allows for documentation of that extension. So we will be having something out to all of you so that you, if you choose to, can use to meet those 2 things, to document and to communicate. Okay, so then the next slide. Likewise with IEP team meetings, you know, we're encouraged, as you have your annual IEP team meetings, to come up, to conduct those virtually or through a conference call so that you can continue to meet your annual IEP team meetings. Again, you know, you want to, you know, include all of the IEP team members so that, you know, you're able to do that. And then if you can't, to use those excusal provisions. So you're following the IDA requirements to the best that you can. You're having your annual IEP team meeting if possible. Next Monday at 10 o'clock, the department is hosting a webinar on sort of tips for conducting parent-friendly and productive IEP team meetings virtually. And Daniel Parker from our team is leading that. And so that's going to be on Monday at 10, and I included a registration link. So if you're interested in that, there's the registration link within this PowerPoint. So the next slide then. But we also recognize in the document that sometimes a virtual IEP team is just not going to be appropriate or possible during this time. Maybe you don't have the information because of the public school closure, or maybe the parents want to participate, but they don't want to participate virtually through a telephone. They rather wait. Or the district has determined that it's just not feasible to do it in this way at this time. So then that would be then these sort of the reasons for why you may not be able to have that annual IEP team meeting within the context of the timeline. But again, if one of these exceptions come up, then again, you want to document why you're not able to meet the timeline at this time. The next slide, please. Okay, and then lastly, I wanted to talk about placement. There's some confusion in the beginning of all this that that there was to be a placement meeting for all students with IEPs. And again, that's something that we wouldn't want to encourage, because it just wouldn't be feasible to have IEP team meetings for all students with IEPs at this point. But also, when you change to distance learning or an alternative means, that's considered a change in mode of instruction, so it's really not a change of placement. And so our guidance document addresses that as how it's not a change of placement, so you don't have to have IEP team meetings in order to provide the distance learning for a student with an IEP or an alternative way of learning during this time. Again, I think as you go through our document, I think hopefully you will see this lens that we really are trying to work our way through, as we all are, sort of what's reasonable, what's possible, and just doing the best we can during this time. The other question that we are continuing to get quite a few questions around is about compensatory services. That is a term that OSIP used in their 2 guidance documents that they issued in March. And we have not gotten sort of further guidance about what that means. So we have asked OSIP for further clarification. We have not heard back yet from OSIP, but when we do, we will be sure to update this guidance document and just put out general information about sort of what those considerations might look like. My guess is that OSIP will say they're individualized, but beyond that, sort of what factors to consider, we're waiting for more guidance on. So I think that's all I wanted to say. So thank you very much. And I'd like to move on to Susan then.
Good morning. I will reiterate what Julia started out by saying, and so that is, as we all know, every day brings another round of news, adding to the rapidly changing situation created by COVID-19. And as an agency, in wanting to support schools, we've created a website with the most up-to-date information that we have access to. What started out actually as a public health update post on our Pupil Services School Nursing and Health Services page has evolved into a K-12 Education and Libraries COVID agency resource webpage. And the information on this webpage includes the most up-to-date Department of Health Services orders, links to emails that Mike Thompson sends out to district administrators, and then within those emails, he's including resources as well as the most current and pertinent information related to schools. We also have tabs that have the most current information on COVID-19 and its impact on several instructional areas. These tabs connect to team web pages, so they're always kept up to date. Some of these tabs included are assessments, statewide and other assessments, such as advanced placement and language assessments. And I'm not going to read through all of them, but some real pertinent topics: food and nutrition. We know we have USDA waivers of program requirements. We have DPI guidance, info on providing meals, emergency meals, graduation requirements, private school choice program and special needs scholarship programs. We have our pupil services and mental health tab that I will introduce Beth in just a moment, that is providing a lot of resources and supports for pupil service areas and mental health. The school finance page, special education, waivers including instructional hours, and then virtual learning and online learning. We also have a tab for resources for families in schools. So on that tab, there's information on technology assistance and online parenting resources related to COVID-19. And then lastly, we decided to add and include a link to the COVID-19 questions. It's at COVID-19 questions at dpi.wi.gov tab. And that tab allows for just a streamlined email submission of questions. Once we receive those questions, we disseminate them to the appropriate team that it applies to in order to provide that timely response to external stakeholders. At this time, I want to introduce Beth Herman. She's an education consultant on our SSPW team, Student Services Prevention and Wellness. And Beth has served as a school psychologist for over 20 years prior to DPI, and she currently supports our school-based mental health grant, as well as the lead on our social and emotional learning opportunities. So I will pass it on to Beth to talk about the vast amount of resources we have related to mental health.
Thank you, Susan. I am staying off camera. My internet connectivity in the southwest part of the state isn't great. And in fact, I have been dropped a few times. And if that's the case, Susan will jump in and cover for the rest of the slides. So when the SSPW started looking at where we would best be able to support the field when we were moving into the school closures, we identified a few different things that we could do. This slide sort of represents that. So if you're like us, you're getting a ton of resources sent to you every day. People are sending lists, your different programs are saying, hey, we've got some things. We felt like one of the things that we could do was to vet and organize some of those supports and present them in different ways and maybe spread out a little bit so that people aren't overwhelmed by them. We've also looked at how we could create resources and guidance to support mental health wellness supports for students and adults from a virtual perspective. We know that people are struggling with things like how to notify when there are deaths, how to reach out and stay connected to the kids that have been on a caseload for the school psychs, counselors, or social workers. How do you manage to still provide groups and all sorts of other mental health supports that were being provided in the face-to-face world of school? And then we also looked at how we could stay connected to folks in the field. I think our team has been primarily focused on a lot of technical assistance over the years, and we wanted to find the best ways that we could do to maintain that. And then, of course, the reality of grants and the expectations of grants, especially the school-based mental health grant, and how that might change as a result of the school closures. Gary, could you advance the slide, please? So sort of just breaking those down, we immediately started thinking about ways that we could organize some resources and provide some direct resources for the field. The very first link will take you to our COVID-19 Pupil Services mental health page, where most all of these resources also live, and then I provided some direct links. The other thing that we did pretty quickly, that online training resource, and many of you may have already seen it, is that we decided to organize, and this was at the request of a district administrator. We have a lot of online training resources, but they've been spread out all over the place. And so what we did is we compiled a list of those. So if you're looking for online training materials that you could provide to your staff during some of this school closure time, they are all there and organized around SEL, mental health, equity, suicide prevention. It's just a really nice, very in organized way to take a look at online learning from SSPW primarily, with some other general DPI resources. The next link is the mental health and wellness during school closure. It's a brand new resource that was just released, I believe, yesterday with Mike Thompson's letter to administrators. And this is providing a look at resources in a couple of different areas for families, for adults, for students. And it was a way for us to sort of collate a number of different things and just provide some very quick, useful ones without having to overwhelm people with big lists. The other things that we are recognizing through a number of our contacts with the folks in the field is that there is a need to start to look at how we deal with grief and trauma as a result of this situation, and how we respond to virtual crises. So there are deaths that happen, whether they're suicides or accidents or as a result of this pandemic, and people still need to activate their crisis response. How do you do that in a virtual world? We are currently working with Dr. David Schofield, who's a national expert in this area, to create a webinar series and some other supports to do that, so that we can kind of give people a little bit more in their toolbox on how to handle these situations, particularly around everybody thinking about reentry, but reentry is really going to not be an event. It's going to be something more staggered than that in all likelihood. And Gary, next slide, please. When we look at providing connections and supports, our team has really been looking at multiple ways to provide technical assistance and, just emotional support about the collectiveness of this situation. We're all in this together. So we've been offering a weekly community of practice Zoom call, which many of you have been on. And we generally have a different theme. We've managed to be able to set it up so that we can now do breakout rooms so that small groups can share ideas. We share a few resources, but this is primarily for folks that are doing the work to talk to one another about how they're dealing with their challenges and what their successes have been. We've had school-based mental health people, community-based mental health providers. We have administrators and teachers. We have a number of folks that join these calls. Each week, we are offering them for 1 hour, and we now had to put it behind a passcode. As you know, the Zoom bombing is a new thing, but it is open to anybody who wants to attend those. And that link will take you to information about the dates and when the next ones will be. We've been sending out the passcode through our listserv, so if you're not on one of our listservs, feel free to contact me so that we can get you set up to receive the emails about these sessions. Accompanying those weekly community of practice calls, we've developed a Google resource folder that everybody who attends those calls has access to. In that resource folder is recordings of webinars. It's the lists of resources and things that come through the chat box during those webinars from the participants. And then it also links to a Google Sheet in which we've opened this up. This isn't a DPI sheet. It's not been vetted by us, but it's just a place that people who are engaged in this discussion can add links to resources that they found useful. They can share what their districts are doing around supporting student mental health at this time. They can ask questions, and they can share information about the technical platforms that they're using to do this. You know, there's a lot of different things to consider when we're looking at providing mental health supports during this kind of situation where people are virtual, least of which is whether or not the technical tools that we're using can provide some level of confidentiality, which we know is not going to be quite what it would normally be in a regular face-to-face situation. It's also looking at our consents needed and how do we engage with families as well at this time. So we also are now offering, I'm going to be doing bi-weekly mental health grant office hours. Again, it's not presentation, but just an opportunity for people to ask questions and share ideas. Greg Curtis, who's our school counselor consultant, is offering school counselor office hours. And I believe that Julie and City will be offering something similar for social work, as will Tim Pierenboom for school psychology. Oh, next slide, please, Gary. So these are some school counselor supports that we have found that have been useful. Many of the pupil services organizations, national and state, are providing links to webinars and guidance documents about how to manage their profession during the closures. And these are some different resources for school counselors that we felt were particularly helpful. Next slide, please, Gary. These are ones that have been helpful for school social workers. And then these are the ones that have been helpful for school psychologists. Now, I divide these by the 3. Please note that this doesn't mean that school psychologists should only look at these. But I think sometimes if you're looking for something specific to your profession, this is helpful. But I will say that at the early onset of this situation, the school counselor association had been putting out some videos about how to do counseling in a school closures, and other professions found those useful. So these could be useful to any of your pupil services team, but we just divided them out because each of these groups' organizations are stepping up to provide resources and supports. Next one, please, Gary. Other things that are coming up regarding the grants management school closures. We've gotten some questions about this. I want to make a distinction before I talk about the telehealth rules and policies. Teleservices are the ones that the school-based folks are doing, particularly connected to special education. The telehealth is the way in which community mental health providers that are licensed by DSPS, the state licensing agency for that, are doing mental health services as they would typically do face-to-face, but they are doing them online. Many of you might already know that if you had teletherapy services and were even able to have your students receive teletherapy services from a licensed provider in another location, there wasn't a way to bill for that. So what the feds and the state quickly did is they took a look and adjusted their rules and policies around telehealth. Many of these are temporary fixes for now, given the situation, but it allows people to do telehealth mental health services and get billed and be able to bill for it. And it reduces and relaxes some of the HIPAA requirements so that staff can still provide those services. This link will take you to a guidance document that was put out not by our department, but by Forward Health, I believe, that talks about the telehealth rules and policies and changes. If you're doing a mental health grant and you have students that were seeing counselors and now they can't do that because they're not doing face-to-face, but they want to do telehealth, this is an option. We recognize that if you have the mental health grant, and I know that many of you are, if not the coordinators of that grant, but also supporting or on the team supporting that grant, we've done some flexibility with how we are providing current funds, how those can be used. My internet is wonky right now, so if I disappear, I will have Susan step in. I have been doing a number of emails sharing with people some of these changes. You are able to make changes to your current budget. And you can include mental health related things, even if they are not on your current plan, but they are student mental health related. You will still need to stick to your 10% non-caps, and you'll still need to make sure that it's an allowable expense, but you can make those modifications. If you're finding that you're not going to be able to get your renewal documents to me by May 1st, please contact me and we'll work something out. What we need to do is make sure that we have a budget in place for you moving into the next fiscal year, so that you can draw on claims when you're ready to do that. So we can work on that on a case-by-case basis. And then you will have carryover authority for up to 100% of what you have not spent. And we have a process for doing that. You won't be able to access those dollars until probably October-ish, when our business office has processed all claims and we know exactly what you have for carryover. And I believe that is all that I have.
Okay, I think we're still monitoring the chat for any additional questions. We have not had any updates yet about maintenance of effort. I don't believe that it is being waived at this point, but if DPI folks have other, I think you covered that.
There, we don't have at this point nothing else. There are no additional exceptions, and we have heard nothing else. It's something that I know is being talked about in terms of a lot of states and locals have submitted comments around MOE, but no additional information.
Okay. Any other questions? And while you're thinking about possible questions, I would just mention we have a survey. If you would provide us feedback, if this is helpful to you, we're looking at potentially hosting another webinar, and that survey can provide us information on topics that you'd want to hear more about. So there's a hyperlink as well as the QR code. All of these slides will be posted on the WCASS website as well, and anybody will have access to them. You don't need to be a member to have access. Let's see, what else was it? The presentation is being recorded, so you'll have the live recording as well, and then all of the links that were mentioned throughout the presentation. So again, Gary's previewing the survey for us there. It's quick, it's short, so please feel free to fill that out. If you want to pop back over to the slides. Just at the top there. There you go. And then just a few closing comments to stay positive, stay focused, stay strong. We're all in this together. I don't know, in your areas, if you have county or CISA-wide meetings. I know in Dane County, we've had Dane County director meetings that have been immensely helpful. So stay connected with each other, reach out to us either at DPI or WCASS. if you have any additional questions. And then one final reminder, we will have a conference in the fall. So what would have been our spring conference has been shifted to the fall. So save the date, September 14th through the 16th. And we are going to focus that conference on kind of debriefing this year, as well as having opportunities to talk with legal experts, go through best practices in virtual instruction, virtual IEP meetings. And as much as I don't like to say it, I think we also have to plan. And there's been some conversation that this could potentially happen again next year. It could be like an annual flu that we see. And so just to have time to prepare and do some team collaboration and planning around if this would happen again. We'll also plan to have a backup virtual option for the conference if by some chance we're not yet back or if we're not yet able to gather in large groups by September. And I'm gonna check the chat one more time. Looks like there's a couple more comments. Interventions at home. So again, I would put those comments in the survey and we would be happy to address more specific questions or topics if we do a follow-up webinar. And with that, I think that's everything. I don't see any additional questions. Anybody else have anything to add before we close out?
Hi, everybody. Thanks, Sarah. I just wanted to add that the comments that are coming up, particularly around compensatory ed, you know, how can we actually carry the interventions out, those sorts of things that are this kind of next wave of, okay, now we're actually doing this. How is it going to be carried out? Particularly around compensatory ed. I know there was a long conversation around that. That is a topic that I think everyone across the country is kind of waiting to hear what OSEP has to say about it. There's lots of different thoughts, as you can imagine, on compensatory education, whether to call it compensatory education, given the current situation. So we will get information out to you as soon as possible. And I know that many of these topics, I love how people were giving each other suggestions here. And at this point, I think that's kind of one of the most valuable things that can be provided at this point is that networking. You know, we can kind of give you the parameters of the flexibility right now, and then how it's being carried out. I love that idea of sharing what districts are doing. And then again, just wanted to thank WCASS for taking the initiative. I know it's something you hadn't done before, so getting out of your comfort zone, as we're all doing right now. So I think it's a really nice example of how we're all trying to make this work in environments where we're not terribly comfortable. So thanks a lot for making this work.
Thank you, Julia. And I just wanted to finish up with just kind of thanking everyone as well. You haven't seen him on here. You see his picture perhaps. Gary Myra is doing a lot of work in the background here and spent a lot of time over the last several days trying to make sure that we could get this out to you as members and that we could continue to do this going forward. So I just want to thank Gary for all of his hard work and his willingness to navigate that anxiety, as Julia said, of doing something completely different, much like our teachers are doing. We are very much learning as we go. Hope that you have found this beneficial. Really appreciate the time with Patty and Beth and Julia and Susan. I know when I'm hearing from them, it just gives me more comfort than when I'm reading it in a letter from DPI or from the federal level, the way that they present it and the same feelings and emotion and comfort that they share is really important to make sure that you guys know that they're there and they're there with us. So please take the time to go back and complete that survey. That survey is what we are going to use to determine Sarah or John, do you have any final comments as well?
No, again, on behalf of the WCASS membership, we just thank you for joining us. We're hoping to have this partnership continue with WDPI. They've been wonderful. And we're just hoping to have updates on a regular basis, perhaps weekly or every other week. Seems like the comments have been positive so far, but if you have topics that you would like us to cover, just let us know. And please know we're pretty excited about this opportunity in the fall to focus on how to respond to return to school and what that should look like, and just have attorneys come and present at that meeting, as well as some other speakers as well. So we're really looking forward to that opportunity in the fall.
All right, thanks everyone.
John jumped in and saved you.
Are you guys done recording there?
Hey, thanks for saving me, John. For some reason it said speaker not working here, and then I clicked it and it muted it instead of.
No, you did a great job, and Susan and Julia and Beth and Patty, Sarah, you all did wonderful. So it was amazing. I really liked it. And you could kind of hear some of the, one of the people asking questions. Are we still recording?
It looks like it, yes.
So I'm gonna stop. I'm not gonna say anymore, but I just want to let you know that you guys did a really nice job.
Great.
Very much well received.
Great.
Thank you.
Thank you. And yeah, good.
Yes, nice job.
Yeah, good for you for doing this for your members. I think it's great.
Yeah. Is Gary still on? Nice job, Gary. I don't see him.
Yeah,
Gary Stone.
I don't know if he's still on, but I certainly will pass it on to him.
Okay. Yeah.
I think we're still recording, so we may want to like log off and maybe send a chat to debrief.
All right.
Like that.
You guys,
sounds
you
good.
guys
Thanks,
all
everybody.
take care. Thank you.
Bye-bye.
You too. Bye-bye.
All right.
Great
Bye.
day. Thank you.